Welcome back. Well, there's concern, right? There's been concern that a substantial drop in child immunization rates in the country have actually subsided since the pandemic started. Has the COVID-19 experience undermined life-saving childhood vaccination? Well, let's discuss this further with the Final Mile Consulting Country Manager, Sangiwe Moyo. Sangiwe, thank you so much for your time this morning. Doc, let's talk a little bit about this. Many said that COVID-19 pandemic certainly put a span in the works for the way in which we systematically do things, never mind as a country, but as a global community. But it looks as though one of the biggest disruptions has been whether or not children get taken for immunisations and their normal routine vaccines and their normal doctor's checkups and the like. Let's just speak a little bit to what extent and just the impact that COVID-19 has had on the disruption of such.
Well, good morning to you, Faith, and good morning to your viewers. Faith, that's a big question in everybody's mind right now to say, did the COVID-19 experience disrupt routine immunization services? The answer is yes. And is the current measles outbreak related to that disruption? There's a very good chance that it is. And I think the study that we conducted, because, coming from a behavior science firm, we anticipated that, the uncertainty that came with the COVID-19 could lead to people's decision points, being disrupted. So when we spoke to caregivers and also healthcare providers, especially from the caregiver side, they faced a paradoxical decision point in that they needed to appraise the risk of COVID-19 exposure if they went to facilities, and also the reward of routine immunization. And you would recall, or you would know this, that routine immunization has never been a big challenge in this country. This is kind of a norm. People decide to take their children for vaccination without even questioning this. But I think more parents appear to make these decisions actively since COVID-19, and they are unwilling to, go to the default of having to trust the health system or the healthcare workers on vaccinations.
Well, if there's a proper lack of trust, Doc, is there no fear that these healthcare facilities will be underutilized? Children will not be immunized, never mind kids receiving their health doses, because it almost looks as though if people have a mistrust in the health system, the same place that they're supposed to go to for life sustenance, I wonder where they're going to for alternatives more than anything else. So how dire is this concern around mistrust?
So we saw this especially at the peak of the pandemic when we had hard lockdowns, especially. There was a drop in the number of people that were attending to facilities. I think that mistrust could also have come through with all the misinformation that came through with the COVID-19 vaccine in itself. But in general, people did come back to routine immunization. I think what happened was that people decided to delay the decision of having to come to the facilities. So as the lockdown regulations eased, people started coming back to the facilities. But you would understand from an immunity standpoint, the damage could have been done by that time, especially with people having to delay this, because it increases the risk for children to acquire these vaccine-preventable diseases like your measles, polio, and so forth. So there's been a shift in some places, and I think this also speaks to, because some of the people that we spoke to, they feel that government could have done more in communicating the continuation of routine immunization services during that time. They perceived this to have been non-existent or quite very, very minimal at that point. And to people's minds, this was like not urgent or not a government priority. I think one of the profound statements that came from one caregiver was that children were invisible during COVID-19. And I think that's a statement that is set within me to say, think about it, children were not a priority at that time. And maybe we could be reaping the consequences of this at this point where we are seeing outbreaks of vaccine-preventable diseases.
Sangiwe, speaking about vaccine-preventable diseases, the measles, right? We're currently facing a situation right now where South African healthcare system has to actually find a way of containing this virus. We've got it in Limpopo province, that's where it first started, and now we understand that it's moved to Gauteng, for example, the Northwest province and the like. The last figures were sitting at about 139 cases of the measles, but it looks as though it's 139 cases of the measles and growing, speaking significantly to the issues around vaccines and how vaccines have been underutilized in this country. At this moment in time, government will tell you that they are trying to contain the situation, they are managing the situation. Is there greater concern, especially within healthcare practitioners, that maybe we do not necessarily know how to contain the situation? Maybe it starts off with the basic education kind of fundamental of maybe we neglected people, maybe we need to be transparent about vaccinations and getting the people's trust once again.
Yeah, you're quite right there. I mean, from a government standpoint, I think we really need a multidisciplinary team to be involved in addressing these issues. For example, the involvement of behavior science into this, because we assume that people's decisions, human decision is rational, but we know people's decision making is very complex, and in some cases people need some nudging to make the best decision for the health of their children. And the bottom line is that no mother or parent wants to see their child die. So there are opportunities, to have multiple disciplinary teams, including behavior science units within the Department of Health. But I think this also speaks to the wider pandemic preparedness from government standpoint. I mean, we really have to look at how systems remain strong, especially on routine immunization side. We saw this even when we had the Ebola outbreak in West Africa. Routine vaccine preventable diseases started occurring after that, and it took a long time to bring back those routine immunization services. So we already had lessons coming from that part of the world, and we could do more in being prepared and ensuring that routine immunization services remain strong and people know that these services continue even in the instance of a pandemic. So that's critical to underline. And also another factor, Faith, is that when people realize they've missed the dose, they need to go to the facility as soon as possible to continue with the scheduling. And one of the issues we saw in our study was that people were afraid to go back to the health facilities because they face rebuke from the healthcare workers and that they've missed the doses. So that's another barrier that stands on the way for people coming back to the facilities. They've missed the doses because of the lockdown period of COVID-19, and now they're afraid to go back and get their children immunized. And I think we could do more to lower the bar and have a campaign to say, okay, come back for your immunization. You won't face these challenges with the health system.
Yeah, it's one of those very tricky matters that we need to get into. As you're saying, the psychology of us as human beings, right? And more than anything else, the trust that we've lost in healthcare simply since the pandemic started, and obviously looking at the lack of transparency within which many were saying that the COVID-19 pandemic was handled with, especially when it comes to the area of vaccinations. But Sangiwe, we'll leave it there for this morning. Thank you so much for your time. Sangiwe Moyo is with the final Miles Consulting Country Manager there. Let's move on.